We're back again. That Lacy Life is back, and we are at Bright Tomorrows in Pocatello, where you work.
Yes, this is where I work.
She's hosting us this time. Not as many of us due to schedules and kids and life, but we're still trying to answer some of the questions that were brought up. And one of the first ones that we were kind of discussing before we started was trends. So the Bird Box Challenge, which we're victims of as well.
We did a YouTube video on it, but we were safe.
Go watch that video, we were safe. But the Bird Box Challenge, that Momo app, I guess it's on, our challenge, it's on WhatsApp, causing self-harm to kids, and like some of the other ones like the Tide Pod and stuff. So that's one of the first topics is, I guess, the trends where people get wrapped up in. So go counselors.
And how do you talk to your kids about those types of things? I like what you said earlier.
Yeah, so one of the things that I talked about as far as connecting with teenagers and stuff and talking through some of those things where our first impulse is to say, don't do that, or, you know, like, this is dangerous and here's all the reasons why. It's good to connect with them by finding that common piece of like what is driving them to do those things. So I gave the example because I worked with adolescents and substance abuse for a long time, and so connecting with them and openly saying, look, like, these are some of the benefits, these are some of the reasons why, you know, a lot of people use, and, you know, tell me what it is that's like good about these things that everyone else is saying bad. And once we recognize, or once they felt like I was actually listening and connecting with those things, and they were more willing to openly talk about all of the aspects of it because they felt like I could understand that.
What do you think?
I also like how you talked about just taking out the white elephant in the room, you know, where the people are. It does feel good. It does, in the moment, take away the pain or take away the stigma that maybe I'm different than everybody else. If I do the Tide Pod Challenge, maybe I'll be as popular, accepted into this group like my peers around me are. Mm-hmm. What do you guys see?
Yeah, even I think cutting is one that we deal with a lot. That not that I would necessarily say that that's a trend, but something that I think parents worry is kind of a trend. That's the feedback we get. But even with that, there's a lot of chemicals that are released in the brain and endorphins and different things that it has a positive side effect. So I think talking about those things and just letting kids know, like, I get why you do that. Help me understand why you're doing that, like, what's good about it. I kind of reference it as there's all kinds of coping skills. Some are healthy, some are not, but they all make us feel better. So what are the ones that are making me feel better?
And we'll introduce Hazel really quickly. She's not a therapy dog.
Yeah, maybe one day.
Yeah, maybe one day. Today she's just with us so that she doesn't potty at her house or tear up her house. So she gets to hang with us.
It's her Christmas puppy.
This is my Christmas puppy.
And they made the joke earlier that she's too mouthy to be a therapy dog. We listen in therapy, right?
So I guess one of the questions that I actually like, I don't feel like I battle depression, but I think I do battle the idea of starting my day on a good foot instead of sitting stuck in my bed playing on Facebook or whatever. And it says, I deal with depression and I would like advice how to start my day. She doesn't work for health reasons. This user doesn't work for health reasons, but she gets in moods where she doesn't feel like getting out of bed. And only to go to doctor appointments. So the idea is like what are motivational things or what are practices, I guess, to help people get out of bed and start their day and do things.
So some of the things, you know, because I talk with a lot of people about depression and stuff like that, and you know, if that early morning depression symptoms, anxiety symptoms are usually one of the things that are hardest to get rid of. A lot of people find that if they can get going in the day, then that stuff will melt away, you know, towards, you know, as they're getting better. So I always encourage people to find a healthy routine and do something like, and you know, for some people that means getting up and praying in the morning. Other people that might be meditating or doing a little bit of journaling, or writing out or thinking through a gratitude list. Just some of those things to just kind of get the mind geared towards looking at the positive, because a lot of times that anxiety or those early morning depression symptoms are coming from the fact of like waking up, I don't feel great, and so then the mind starts using that emotional thinking.
I work out super early in the morning, and that helps with the endorphins for me, and I'm in a community of positive people, and I think that helps me start my day on a positive foot. And it is hard to get out of bed, and so I can only imagine what it would be like if I was battling something like depression or anxiety along with that. But I think if you can force yourself to take that first step out of bed and then get yourself into a positive community where you're uploading your endorphins for the day, then that can be really beneficial for you.
Yeah, I would agree. One thing with depression that I have told clients is sometimes you have to fake it till you make it. So the way that our brains are wired, every time you're not getting out of bed, it's reinforcing that that's not a thing your body wants to do, and it just kind of strengthens that pattern. So if you can, even when you're not feeling like it, make yourself get out of bed, it's going to strengthen that neural pathway and help you to develop better habits. And so I think one thing that's easy to get caught up in is I don't feel like it. So you kind of got to not let your feelings rule your decisions and the things that you do. That just like when you take your kids to get vaccinated, if you do, it's not a pleasant treatment, but it's also healthy, and so you do it anyway, even though it's unpleasant and it's going to be really difficult sometimes. You still do that treatment, and so kind of helping your thoughts override your feelings can be helpful sometimes with that. Saying, I know this is what's good for me. I don't feel like doing it, but I'm going to do it anyway. And the more that you develop that pattern, the easier it gets. I think I agree too. Finding something that's positive in the morning, something to look forward to, whether it's exercise or having a cup of coffee, or something that's pleasant for you to kind of roll into the day. I think once you're out of bed, it gets a lot easier.
And on the flip side of fake it till you make it, sorry, you were getting prepared.
No, go ahead.
The flip side of fake it to make it is sometimes it's okay not to fake it, and just to be upfront and transparent with whoever lives in your household, or a friend that you can call on the phone and say, I'm struggling today and I could use some help and support getting me, into a positive mind frame for the day. And so it's okay, and I'm hoping our mental health world is starting to shift into that way where it's okay to say, I have depression, and this is what my day looks like, and this is why I'm struggling, instead of always pretending like we're okay. On the flip side again, though, sometimes you have to trick your brain and tell your brain, no, I'm okay, I can do this, because then your feet will start to follow.
Yeah.
I can see that both sides. Big thing for me, one thing that I do in the morning, it's tough to get up in the morning, and I could only imagine how it would be to, be depressed and have to do that as well. One thing that has always helped for me is playing some music. When I get up in the morning, playing some upbeat tunes that can help self-talk, talking to yourself, and telling your mind some positive thoughts that could help get you going for the day.
This one's pretty heavy. I almost wish my sister was here. She's a psychiatrist, so to add to it. But this one talks about a teen, I believe it looks like, a young adult that dealing with anxiety and getting provided medication. And the idea that it doesn't really feel like it was discussed or talked about, but she was just prescribed, or he was just prescribed medication to help the anxiety. And they're wondering, the idea is, what's the best practice? I mean, how do they do it as far as the healthcare world, or what kind of things could they do to help change that aspect of maybe not it being discussed, but it just being, well, here's your prescription, see you later. I mean, for me at work, prescriptions are pretty tough, right? I mean, as soon as somebody gets a pain pill, if they can't afford them, or if they're done with them afterwards, I mean that, and then or if they're addicted, it can lead to other things. So I don't know if anti-anxiety medicine is the same way. I'm not a medical professional, but what do you guys think on that aspect?
Kids in school, I see benefits and I see worries. I definitely think sometimes medication helps, and it feels good for children and their families to have successes. And sometimes they don't have successes or haven't seen successes for a really long time until they get on medication. Flip side, sometimes they worry because then they have a lot of successes, and then we stop teaching the skills that they need for if they decide to get off of medication at some point. And I've noticed a lot of teenagers, and especially kids as they hit 18, they don't want the medicine anymore, or they can't afford it, or insurance doesn't cover it, and then they're left without the skills that they need to keep being able to have successes in life. So there's definitely pros and cons to medication, but there always needs to be a conversation with the family, with the individual that's going to be taking them, and then a doctor and a counselor.
I know in my clinic, because we offer counseling services and medication management services, and so the education I provide with my clients is there's a lot of different approaches out there, and different things work for different people, and so we try to kind of take in an approach of all of those things. We talk about, you know, for a lot of people, medications and counseling is beneficial because the medications can kind of help keep a lid on the symptoms so that they can focus in counseling and not have the symptoms distract them while they do kind of that deeper seated work. Then we also talk about things like exercise and nutrition and sleep patterns and all those things because, like I said, each person is individual and each person is going to find different things that work for them. So yeah, I would say best practices is to talk about all of those things and give them options and let them decide what would be best.
And I would just say, as far as the provider goes, if that's not a conversation that your provider is having with you, it's okay to advocate for yourself and to bring up that discussion. Like, you know, I'd really like to talk more about other options. Anyway, I was just saying that it's okay to advocate for yourself, or have your parents advocate for you, have these conversations with your parents, if that's who you're going to appointments with. But if you're not feeling like you're getting everything you're needing from your provider, they're providing a service for you, and so it's okay for you to say, I'm needing something else, or I'm needing more, I have questions. It's always okay to ask those questions. And if your provider's not open to that, it might be time to shop around and find someone who is open to meeting your needs, because that's what we're here for.
Do most providers, so like if you go to, you know, if I take my child to a doctor, right, because my child's suffering from anxiety or whatever, and then do most of them combine their care with counseling too? Like, will they say, okay, yeah, we think you may need X medication, but you should probably go talk to said counselor, or is that not normal?
I think it depends a lot on the provider. I've heard it both ways, that some are very pro mental health treatment, and will say, you know, I'm gonna give this prescription, but I'd like to see you follow up with some counseling, and we'll be checking in about that. I've also seen providers that will just write out the prescription and that's it, and we'll keep refilling it and refilling it and refilling it without ever seeing if there's anything else going on. So I think it depends on how informed the provider really is.
So it's your guys' job to make these providers informed about their skills.
We can't make anybody do anything.
Okay. So sticking with the anxiety and the depression, there was a user asked, how do they stop being mad at themselves from suffering from that? So they're frustrated.
They have some guilt.
They feel guilty and they're mad at themselves for actually having that. Are there avenues or ways to accept it? I mean, I was mad at myself for not being in the NFL, but at some point you have to accept. I have to accept it, you know, even though I feel like it was my fault, I could have done better or whatever. Is it the same in mental health? Like, what do you think?
So there's, I feel like there's a lot of self-guilt I see with a lot of clients. And part of it is like the societal pressures that are put on us as individuals. And one thing is to accept, like, it's okay to be mad or feel angry or sad or lonely. Those things are okay to feel. And at the same time, helping like reframe that to where it's okay to have grace on yourself, to where like if you don't, you know, if you did something wrong or you didn't succeed in a certain area that you wish to have succeeded in, that's okay too.
Anybody else?
I think that's something a lot of people struggle with, like you said, and you know, that's definitely one of those things that counseling can be really helpful in, you know, because that's kind of a deep issue that sometimes needs to be pulled apart with the help of someone outside of yourself to help you reframe like some of those thoughts and some of those concerns that you have. So that to me would probably be an indication that that would be a good time to start seeking some services for that.
And knowing that your life doesn't have to equal for the rest of your life. I have depression, I have anxiety. That's one of those kind of symptoms up there, but there's probably something deep down, you know, that a counselor can help you work through to figure out why you see the symptom of depression or anxiety popping up, flaring up. So there's such a stigma on us to be okay and to showcase our highlight reel all the time. And I just think it's really powerful when somebody can come out and say, I struggle with this and I'm working through it. I think that's really powerful, and I have a lot of respect for people when they're able to do that.
Yeah, I agree. I think remembering too that these things are illnesses and there's a physiological thing going on in your brain a lot of times that's causing some of these issues, or perhaps it's environmental things, but just like you wouldn't be mad at yourself for having diabetes or having you know, any other kind of medical illness, I guess, compared to a mental illness, it's the same sort of thing. So just trying to take it easy on yourself and remembering it's not something that people choose or wish to have, and it's not something that you caused, and kind of comparing it to a medical illness, I think is really helpful.
Doesn't mean you're lesser than or weak.
I kind of like equate it like how you described it. If you're feeling that way, then you probably need to seek counseling. I kind of equate it to like working out, right? Like, man, I'm feeling weak. Now I need to go work out. I think if that weak as in my muscles are weak, not mentally weak. But in this situation, if you're starting to feel like you're down on yourself and you probably shouldn't be, you know, then it's like, oh, I need to go work out, meaning I need to go talk to somebody to help me. I think that's a good idea.
Yeah.
This other one, let's see. Sorry, I'm looking at my phone, but there's a lot of them, so we want to make sure we cover them all. It says, what would you do if someone said they wanted to kill themselves or someone else? And this is a really good one, I think, because this one talks about, I think it hits on your guys' confidentiality thing, and when it is nullified, I guess. So you're up, counselors.
That's certainly one that the teenagers that I work with, I see that a lot, where they're worried about a friend who's maybe made some statements about having suicidal thoughts or that sort of a thing. And that's one of those things that it's just safety first is the most important thing. And helping people understand it's better to say something than to not say something. So because I think just always thinking about safety, if someone's life is in danger, if they could hurt themselves, they might be mad at you for telling for a little while, but they'll thank you later. So I think always tell when you have concerns. It's so much better than having regrets later on if something happened and you didn't say anything.
It's okay, all we have to do is put this up and then I can cut.
We smiled a little bit because of the puppy. We weren't smiling because the issue was light. We were smiling because the puppy was doing something naughty.
I actually had a girl today drop a note in my drop a note box and said, I have a kid at daycare that every time he gets mad, he always says, I'm going to kill myself. And she said, I don't know if he's being honest or not, and the daycare workers just tell us we should ignore it. She says, but you tell us not ever to ignore it. And she said, what do I do? And so that was a really powerful conversation that we had where, you know, maybe educating these daycare workers would be helpful, talking to parents is helpful, which is what I ended up doing to help this girl out. But she was really concerned about his welfare and felt like that nobody else was taking care of him. And so I think it's having those conversations, and just we always take it seriously. If somebody wants to harm themselves or harm others, that's a serious thing. And no matter if you think they're vying for attention or not, we take it seriously and show them we care.
How does family counseling work?
So I don't do any family counseling, but I've got another provider in my office that does some work with couples and families and stuff. And family counseling most of the time is really directed towards opening up communication within the family, because so many times problems come from people, feeling misheard or not heard, communication just lacking in that. And so really the role of family counseling is to help the family members understand each other, how to understand how to express themselves in a way that's healthy so that it keeps those lines of communication open. And the counselor is really there to help teach that and facilitate that in an environment that's safe.
What's the format? I mean, is everybody together, or if there's a family of 4, do they all sit down together and talk? Or
Yeah, it kind of depends on the family. There's some times where it is helpful to have the family in there so that the therapist can see the dynamics of how the family communicates and work on improving those things. And other times it may be, the parents and one child, or one parent and one child of a family set that they just want to work on some of those things. So it really kind of depends on what the goals of the family are and what the purpose that they're seeking therapy for.
Cool. Anybody else have anything to add on that one?
I could just say what I know about family therapy is it's all about the system. It's about the family as a whole. And if you go to family counseling, there'll be a safe place provided for you to where if there's some conversations that you can't have in the household because you feel like you'll be judged, or you feel like you won't be heard, or you feel like if you speak up about something that you would typically get in trouble for, being in family counseling, there's a space where it's okay to talk about all those things. And a good counselor will make it safe for that to happen.
And help create goals and, just like you said, facilitate healthy conversation.
Mm-hmm.
They're kind of the mediator.
Yeah.
Let's see. How do you work with a teenage client that doesn't want to come to counseling? That's a good question. I think all of you guys probably have a story or 2 or 5 about that.
We get that one a lot, that's for sure, where a parent's like, well, I'd love for them to come to counseling, but I just don't think they're going to talk to you. So I let parents know it's their job to get their kid here, and it's our job as counselors to get kids to open up. And so really that's what we're trained to do, is to be able to talk to people and help them to open up. And that's true for teenagers too. And so we spend a lot of time rapport building, but as long as you can get them there, that's you can leave the rest to us. But I will say also, not every counselor is going to be a good fit for every client. And so if you're just feeling like there's not a connection there, it's okay to try a few people out, or even go meet a few different counselors, and giving your child a choice in the matter, saying, listen, I'm going to let you meet 2 or 3 counselors, and then you can pick which one you think is going to be best for you. I think that can be helpful too.
What do you think about, maybe there's not a huge issue, but you just feel like maybe they need some support outside of the home? And they're just not ready for it. Do you think it's okay to respect that, so that they don't have a bad taste in their mouth for counseling when they may need it later on?
Yeah, we've definitely had that situation too, where kids come and they really just aren't ready to talk. So here at Right Tomorrows, we work pretty exclusively with sexual abuse, and some kids just aren't ready to talk with us about it, or talk with anybody about it. And so we do some education and that sort of thing, and try and give them some skills. But then beyond that, we're certainly never going to twist a kid's arm to talk about things that they're not ready to talk about. So that can be re-victimizing.
Stop. Do you want to see what he's doing, or are you good?
Hazel's chewing on something.
Come here.
Is she good? I keep calling
I
her.
think she's okay.
Okay. I should know if that was in your mind or not.
Hazel's safe.
Did either of you want to talk on?
No, I everything that I had in my mind, you answered perfectly. So yeah,
Perfect.
Thank you.
yeah. Kudos.
And we spend a lot of those first sessions not even diving deep into any type of work, just really building a relationship and that base of trust with whoever we work with, so that they do feel at some point like they can open up to us, and that they trust in the confidentiality, and they trust that we're not going to judge them.
Yeah. And that looks different with teenagers than it does with an adult, or than it does with a younger child. That rapport building looks different with them.
Well, you guys all look young, so that helps. You aren't too out of
They
touch.
can connect with me.
Yeah, they don't feel like that you're out of touch.
Yeah.
So that's a good help.
That's why I
Teenagers
wear
are my
Nikes.
people in counseling. That's like, bring your teenagers that hate being in counseling to me. I love it. I really do.
The challenge. That's the challenge. Well, whoever asked that question, she's
I'm your girl.
She's your counselor. Let's see. Ooh, this one's tough, and I could relate to this because I want my instant gratification. It says, I've been going to counseling for a while, but feel I'm not making progress. How do you deal with that? As a counselor, I guess.
Well, you know, kind of going back to what you were saying on the last question, not every counselor is a great fit for every client with every problem they're facing. And I've been on both sides of this where I've had someone that's come to me and we've made good progress and then kind of plateau. And then they've gone and seen somebody else and that other person has helped them get over that, you know, that last little bit. Sometimes a little bit of a different approach is good. And sometimes there's just certain things about certain people that you feel, you know, with your counselor where you feel more comfortable being completely open about some of those things.
Yeah.
And you just connect with them differently. So that's, you know, that's one thing that I encourage, and I always encourage my clients too, and recognize that this is really hard, but if you feel like you've gotten to that space, let's talk about it, right? Don't just disappear. Let's talk about that because that may give us an opportunity to rethink what we're doing as far as an approach. And if, you know, if I'm kind of feeling the same way, then the conversation would be like, let's talk about some people that might be a good fit for you to help you through the rest of this.
So as a counselor, you guys wouldn't feel insulted, like
No.
you guys
No.
are-
No.
And if your counselor does, then it's time to get a new counselor. they're making it about them at that point.
Right.
Right.
So.
It's not about us. That
Yeah.
whole thing is not about
So like
us.
in a sense, a client kind of controls
Absolutely.
it, right? So I mean, it's like,
Yeah.
I feel like this isn't helping. Okay, then you guys will readjust, and if it's not something that you can do, maybe she could do it. or-
Yeah, for sure.
But I love what you said, don't disappear, because it's nice to be able to close that relationship and close the work that we've done. And then we have so many resources out there of people that use different approaches and theories that we can help support you in finding that next person. So don't disappear on us.
Yeah, I agree. And I would just add on, be really honest with yourself about what the motivation is. If that connection's just not there, or the counselor does not have the skill set that you need, that's one thing. But I also have had clients that are like, this isn't working. And it's like, well, that's because I just called you out on some things that you didn't want to hear. So
Right, and
that's,
sometimes
that's
it gets
part of
hard.
too. Sometimes
Yeah.
counseling's really hard work, and fighting through those things can be difficult. And so having that honest conversation with yourself is important too.
I like that.
What? You gonna check on Hazel?
She's okay. She's okay.
Hazel check 2019. What do I do if it's my? Oh, we're dealing with this at work. Actually, we have a mandatory counseling session that we're supposed to go to, and it says, what do I do if it's my day to go to counseling, but I feel I have nothing to talk about? I mean, you know, I have to go because I'm mandated to go, but I say I'm doing okay and I get to leave, which is fine. But I guess this could be a client, so if it's their day to go, but they don't have anything to talk about, what would you, as a counselor, what would you want them to do?
A lot of times in the schools, they have like that set day, and if they come in and they're like, you know, this week's gone pretty good, I'm working towards my goals, here's some examples, I let it be. I let them say and mandate and decide what they want to do. It's their session and it's their power. And so I'll say, if you're comfortable right now and you want to continue working towards these goals that we're talking about, you feel like you're on a successful path, we'll check back in next week. So I think that's okay sometimes, but others, what do you think?
Yeah, in the community setting, that when I have a client that kind of comes with that, that's usually a good opportunity to say, okay, like, this is what our goals were when you started therapy, and you know, you're saying that you've made good progress on those things. Let's reevaluate what we're at, and if we start to talk about, let's, you know, lengthen this out and monitor how things go, and then talk about termination, or do we shift focus and start to look at some other things, you know, and just having that open conversation, being honest with the therapist really helps to drive that conversation of like what we do next.
Just sometimes we also will get people in that say, oh, but everything's good, doing good, don't want to talk. And underneath we know that there's still some patterns going on or that there is hard times. And so that's our job as a counselor, to help you address those things in a safe manner.
Yeah, so I think, again, it goes back to chatting with your counselor about it. And that can even be over the phone. If you're like, can I just talk to them? And then talking over the phone about it, whether you should come in or not, I think would be a good thing to do even. But sometimes that's an indication that maybe you have made the progress that you were looking to make, and maybe it's not time to be done with counseling, but let's go longer stretches. Let's try going every other week and see how that goes, and then eventually look towards being done with counseling. So
Our goal is not to have the same client list for years. Our goal is to get you in and help you solve those problems and be in a place where you feel more healthy, and then be able to move you on into the next transition in your life.
This is a great question.
These people are amazing.
This is a great question. It says, do I have to be diagnosed with a mental illness to come to counseling?
it depends on where you're going to counseling.
And what your insurance will cover, if that's something you're using.
Well, let's take money aside. No money aside, so no insurance, no whatever. I mean, obviously, Bright Tomorrows is designed for children that are victims, but counseling in general, do you think that you need to be diagnosed to go?
I don't think so. As long as you have a goal, something you want to work towards.
And sometimes you come to counseling and have no goals, and you're feeling hopeless and have no idea what you need to do to help your life. And those are things that we can help you address.
Real talk though, your counselors, if they're gonna bill for you, bill insurance and get paid, they're gonna have to diagnose you usually.
So how does that work for like marriage? My marriage is failing.
One of the individuals has to be diagnosed usually.
Really?
This is good information for me to learn.
Because in the schools you don't have to.
in the
In a
schools.
nonprofit, a lot of times you don't have to, or when you're not billing for services. But to bill for services, just like a doctor would have to diagnose you with whatever. I'm not a doctor, so I don't know. A cold or whatever.
Yeah.
But whatever it is.
So you couldn't just they can't just bill me personally. I need to talk to somebody. I don't want to talk to my wife. I don't want to talk to my friends. I want to talk to somebody that is a professional listener, right? In a sense. But they would have to figure out something that I'm to talk to me. I can just go in there.
If you're billing the insurance, like if
Always
someone
it's
just wanted to
insurance.
come in and say like I'm facing a couple of things and I need to get through this, and they're willing to like do a cash pay price,
Oh,
absolutely, like there's no problem with that. And on the flip side of that too, EAP programs are good for those types of situations where like maybe Aunt Jean just died,
right.
and that's not necessarily a mental illness. I'm just struggling with the grief. I want to talk to somebody. Those EAP programs
Right.
through work, a lot of times you call them up, tell them what's going on, and they'll authorize you to go talk to a counselor for a little bit to just get through that.
And there's also some flexibility with diagnosing. It's not always going to be anxiety or depression or this or that. There's a diagnosis called adjustment disorder, and basically what that means is something's come up in your life that has been causing problems, and you're having a hard time adjusting to that.
Right.
And so that's one that I know counselors use a lot when it's not really truly a mental health issue. It's just things have come up in life that have been difficult.
That's good to know.
So this is totally off topic, off the list.
Yeah.
Off the list, but the idea though, being diagnosed is not a bad thing,
Right.
right? I mean, I think that's something that should be clarified. And then mostly the diagnosis is just to check a box in order for insurance to help pay.
Yeah.
Sometimes.
It depends.
I mean,
but yeah.
in the situation that we're describing,
Yes.
like I'm not, maybe I'm not diagnosed with depression. I'm not bipolar. I'm not any of these things.
Just struggling.
I just need to bounce some ideas. I might change careers, and I just need to talk to somebody. I can't talk to my wife because she's too invested personally. I don't want to let my friends know. I don't want to let my coworkers know at work, right? Because I'm about to quit or whatever. But I need to talk to somebody that can kind of help me manage my thoughts. I guess in that portion you can still go.
And you probably have a couple sessions before you have to make a diagnosis, is that correct?
Well, usually you do an assessment, and that's kind of where that the diagnosis comes from. So
Okay.
you gather your first appointment usually is your counselor asking lots of questions, gathering history, those sorts of things, and then
Okay.
the diagnosis is formulated after that.
And I think too, if you have a question like that, call call an office, talk to a counselor. You know, if you know somebody that other people that you know have seen and they like, just give them a call and have that conversation of like, this is kind of where I'm at. Like, what are my options?
Right.
You know, because we could talk through about, you know, doing a cash pay, or if you have access to an EAP, or if there are other resources that might fit with what you're looking for from those counseling sessions.
And if you have insurance, you can call them too and kind of see what they cover and what that might look like. And don't ever be afraid to ask your counselor, so are you diagnosing me, or what is that going to look like? That's something that I think is important to ask.
So this is a question that pops up in my head. Does that diagnosis then follow them if they try to get into like a government job or into the Army or into the Navy, but all of a sudden they've been diagnosed at some point in their life with...
Yeah. Some of them can, right? And so that's part of the conversations again to have at those times of services, as far as like how this is going to impact things like employment, because those are always a possibility.
And with younger kids, is ADHD, ADD, are those things diagnosis enough, or does it have to be a specific mental diagnosis with that
would
medical?
qualify.
Mhm.
ADHD would qualify as a diagnosis.
Okay, so it doesn't necessarily have to be depression, anxiety,
No,
bipolar,
there's
schizophrenia.
how many? There's a book this thick full of
Yeah.
diagnoses.
So through that DSM.
Yeah.
Okay.
DSM manual. I remember that at my house.
Yeah.
Okay. Yes, we have those.
Okay, and this is the last one, I think. Yep. It says, how long do I have to go to counseling before my issue is resolved? Yeah, I only want to talk to you for 20 minutes, and I need perfect after I'm done.
Let me get the crystal ball out. Hang on.
So how long? How long do I have to go?
In schools, kind of our goal that's in our head when we start counseling is about 8 weeks. We try to work with you through about 8 weeks and see, but we're never going to drop a student if at the 6th, 7th, 8th week that we see that they still really need support. But we would try with our client, our student, to kind of map out what can we do over these 8 weeks to help you reach some of these goals so you can be more successful at school or at home or in your relationships. What about in the community?
As long as it takes. So at Right Tomorrow's we used evidence-based treatment, so they're usually a little shorter term, 6 to 8 weeks with one of them. We use trauma-focused cognitive behavioral therapy. That can be anywhere from 8, 12, 20 weeks, but it's, in the grand scheme of things, a shorter treatment model. But it depends, the same, that if a child is still struggling and we've hit 20 weeks, I mean, we've had kids that have come here for a couple of years. It just kind of depends on the issue. So that's a hard one to say how long it takes to treat. It's so
Very
individualized.
individualized.
Yeah, I don't really have anything to add to that. It's just, you know, kind of depending on the problem, depending on the approach, and there's a whole bunch of factors that come into that. So yeah, as long as it takes until you feel like you've met those goals. Oftentimes I'll have a conversation, especially if there's concerns about how long am I going to do this or need to do this, then we'll have a conversation of like, what are you willing to commit to right up front? Let's set like a date, you know, is it 8 sessions out, and then we'll reevaluate where we're at and where our goals are, and then we can go from there, but you know, commit to me this time frame.
Well, those are all the user questions, or the viewer questions, I guess.
User.
Users. Viewer questions. I don't know. You guys got anything else to add? Nothing?
No. I would just say, I think there was a theme though of talk to your counselor, have those conversations. All of these questions are questions you can ask your counselor, and if you feel like they're not listening or addressing your concerns, then.
And we recognize too, it can be really scary sometimes to take those things to your counselor, because you don't want to hurt feelings, like you don't want to disrupt anything. If you have a good connection going of saying like, hey, I think I'm getting close to being done, what do you think? But really the counselor is there. I tell my clients I'm super hard to offend, and if you do offend me, I get over it pretty quick. So let's just have those conversations and throw it out there so that we can talk through it. And you know, that's what a healthy therapeutic relationship looks like.
Right. Having those critical conversations is what we call them.
I guess the last one, I guess we talk about it, and I think it's easiest for us to think, because I'm surrounded by 4 counselors, right? But how do you find a counselor? I mean, how do you find one if you need one? I mean, I know I can just ask, my wife, hey, where should I go? But at the same time, what do you suggest? How do people look for counselors?
Universities have amazing counseling centers. Each school will have a counselor. So if you have a child in school, you can talk to that counselor and they'll have usually a community referral list. I feel like social media is an amazing place to start if you feel comfortable in doing that and saying, hey, I'm looking for a counselor, say for a friend if you need to. And you'll get a laundry list of people and you can see if there's one that maybe hits a couple times on there that might be.
Yeah, I would say word of mouth is a great way to find a counselor, because usually it's going to be people who have seen that counselor and can say from experience, that this is a good person that I've seen.
But I've also noticed if you just type in your area counseling agencies and then go to their staff profiles, usually they'll have a picture and they will have a brief description of what that counselor specializes in and what their trainings are in. And so you can kind of see if maybe one of those fits or, it helps you to feel comfortable.
What MD, right? I'm a doctor. What should because we talked about in that first series about people saying I'm a counselor, but they may not be.
Right.
What are the initials that they should look for?
So an LPC would be a licensed professional counselor, and then the next step up where you've gotten more supervision and you've put in some more hours perfecting your craft would be a licensed clinical professional counselor, so an LCPC.
And then there's some other options out there, like a licensed clinical social worker. They've done some additional training and stuff after their programs, and there's some good social workers out there that do really good work in counseling. And a licensed marriage and family therapist, an LMFT, is another one to kind of look for. Those are going to be the people that specialize in like family therapy, couples therapy, and those types of things.
And that really varies state to state. There's not a nationwide licensing system, so different states have different licensing, but what you're going to want to look for is someone with a master's degree typically, and licensed. That L in most of our licenses, that's really important, because you can be a professional counselor but not be licensed. So the C in a lot of these is clinical, so that just, like Holly was saying, means that they've had additional supervision and experience, and usually a few extra years of experience. So.
And I don't want to leave out the psychologists. There's psychologists.
My sister might be mad.
She's a psychologist, not a psychiatrist, just FYI. No, she's a psychologist.
But she's got her doctorate.
Yeah.
I thought
she's a
A
psychologist.
psychiatrist is a medical doctor that specializes in psychiatric issues.
Right.
Sorry.
And then there's psychologists. It's confusing though, I think.
Yeah. It is
That's a common
confusing,
question.
Yeah.
right? Between, what can a counselor do versus a psychologist versus a psychiatrist versus a social worker. And truly, you probably are going to have a team at some point working for you or advocating for you.
Sweet. Sorry, girl. Bye, guys. Ask more questions. Part 3 coming soon, I guess.
Maybe.